All right, welcome back. Part three of our week 5 lecture. We're covering chapters 9, 10, and 11. And so 11 covers general completion and submission requirements for the two claim forms. Not to worry, you will not be completing either of these two claim forms. The book, as I mentioned, is designed for individuals who are going to be performing the billing function, but on your respective exam, CCS or CCSP, you need to know these things in case they ask you a question about them. So, here are the 8 objectives. There's 2 claim forms. Let's get into them. So, the CMS 1500 claim form is used for professional procedures and services. The CMS 1450, now I know you're thinking, she just said 1450. Where is that on the screen? So, the government name for the UB-04 claim form is the CMS 1450. But out here in these streets, we call it the UB-04 claim form. Okay. So the UB-04 claim form is for facility services, inpatient and outpatient facility services. Keep in mind that both of these claim forms go to, when we're talking about Medicare, will go to the Medicare administrative contractor. I want you to think about this because we just talked about compliance. Let's say a patient is admitted to the hospital and the hospital submits their UB-04 claim form. And then the doctor that saw the patient submits their 1500 claim form. Well, what if the diagnoses are totally different on these two claim forms for the same patient for the same date of service? We got a problem. So it is so important that no matter where you work, that you ensure you know coding rules, you ensure that you are coding and subsequently billing based on what is documented. So, we talked about HIPAA previously and how HIPAA mandated HIPAA Title II, which is the administrative simplification, I think is what it was called. Um, it basically stated that in order to submit claims, we had to follow these transaction standards, and they're called ANSI, and I can't remember what ANSI stands for at this point, but there are standard formats that are used to transmit those claims. So, the Simplification Compliance Act prohibits payment of CMS 1500 claims not sent electronically. Can't get paid, you don't submit it electronically unless you fall into this list here. Here's a picture of the CMS 1500 claim form. It is also found in your textbook. You can also grab a copy of it from the Medicare website, CMS. This is the claim form for professional services, no matter where the professional sees the patient. Okay. And then the hospital version of that, the UB-04 claim form. And what did I tell you? The real name, the official name, and the book actually says it too, is the CMS 1450, but we call it the UB. It's the UB-04, but we literally call it the UB. And in your textbook, one of the things I love about your textbook, you can click on a word that's highlighted or a figure that's highlighted, and another box will appear. But this is the form that is maintained by the Uniform Billing Committee, henceforth the name UB. This is for facility claims, inpatient and outpatient. So DRG and APC. All right. So when we're submitting claims electronically, what happens is that data is converted and transmitted to the payer. Now, in a system like one that you'll probably know, Epic, you heard of Epic before. Epic, Cerner, all these different systems, you're literally plugging in information into little fields on a computer screen, and then the software then puts it where it needs to be. So let me just go back for a sec. So you register the patient, and the system is going to put the patient's name and address and insurance all into the proper location on the form. Okay. So, for OCR purposes, when we're talking about data entry, here are the purposes of the uses of data entry. Can't talk. This is video number what? Um, you got 5 chapters in CPT plus the 3 here, 8 for this weekend. Luckily, there's no Super Bowl. All right. So on the claim form, there are some blocks on the 1500. So 1500, the little boxes are called blocks. On the UB-04, they're called field or form locators. And so there are certain blocks on the 1500 claim form that we can say things like signature on file or accept assignment because of things that were done before the claim is submitted, right? So, for example, when a patient signs in, we register them, right? We have their signature on file. Accept assignment here is we are saying that we accept what they pay us as payment in full. The patient is still responsible for their part, but we're talking about what they pay us. Okay. And remember, I talked about in the last chapter, those fee schedules. And so the fee schedules, we know how much we're going to get paid. No matter how much we charge, we know what we're going to get paid. So here you will see 2 little snippets of each claim form. The first one on the left is the 1500. Notice that the diagnosis codes are listed without any decimal points. So Z00.00, that's that adult physical exam code. No abnormalities found. So that's what you see on that claim form. On the right, you see the UB-04 claim form, J44-9, which is unspecified COPD. Yeah, I think that's what it is. All right. So when a patient has a primary and a secondary claim, a secondary payer, there is a place on from a billing perspective where you can enter in they have a secondary insurance company. And so what happens is the claim first goes to the primary payer, they review it, they pay us, then we send the claim to the secondary payer, letting them know how much we got paid from the first one. Now, some situations are set up where the claim automatically crosses over. So, like that could happen with a Medicare and a Medicaid situation. But this happens when we put on the claim form the patient has a secondary insurance. So here are the different blocks that you see on the claim form. So at the top, the type of payer is checked: Medicare, Medicaid, Tricare, other, which is, other types of insurance, group insurance. You see a spot for the primary insurance. On the right, in block 11, A through D, that's where the primary insurance goes. On the left, 9A through D, that's where the secondary insurance goes. Don't ask me why they are backwards like that, because you're probably thinking, why doesn't the primary go in 9 and the secondary goes in 11? It's been that way since I've been doing this since 92, so I don't have a clue. I just follow the rules. All right, so there are some common errors that delay claim processing. So, of course, you always have human error, inputting the wrong information, leaving out some information. You submit an attachment that doesn't identify the patient. When you are using a paper form, you don't align the paper properly, right? Handwritten items other than the signature, right? So, not having medical necessity, linking the diagnoses to the procedure, right? Just little things can delay the claim. Here are 5 steps for processing claims. You just making sure that everything is correct from start to finish. All right, maintaining the claims. So, number one, CMS has a rule, and I think it is 7 years that we have to maintain all of these records. And we have to maintain them because if they ever come back and ask us for proof that we provided the service, we gotta have proof. Right? And so our supporting documentation is what we need, right? And that includes all work papers that are associated with this process, and you can see the list there. One thing previous students have said, man, this stuff gets real deep, right? And I know you're thinking, I'm not going to be a biller. I'm here because I'm going to take the CCS or the CCSP. And while that is true, you never know where life leads you. So you want to have more knowledge than you need. Mm. All right, UB-04. Take a sip of my tea. This is for facility claim forms, inpatient, outpatient services provided by hospital. I told you that the little boxes are called form locators on here. On the other, the 1500, they're called blocks. All right. So there are here again lots of information that is automatically populated as the patient registers and progresses throughout their care or stay at the hospital. And so a lot of the systems will talk to each other, which will then allow it to auto populate on the claim form. Okay. Here is an example of a data entry screen where the patient is being registered, and then again, how that information is going to cross over onto the claim form. So, this claim form, the UB-04, which is the claim form for facility. Oh, this is the name of the organization, the National Uniform Billing Committee. They review this form. So, and they're looking to make sure that the data that it collects is consistent. It allows for data collection. And so you're probably wondering, is that UB-04? Is that 2024? No, it is actually 2004. That was the last time that the form was updated. And let's just get this out there. Before 2004, it was 1992, right? So HIPAA mandated some changes to this, and we saw them on the 2024 version of this form. So if all is well, they don't update the form. The codes change, right? But the form, the data that's collected and reported stays the same. So, on the UB-04 claim form, the new the NUBC balances what payers need against what we are obligated to report. And then I already mentioned HIPAA kind of mandated what goes into each little box, which are called what? Form locator. So each little form locator has an actual name. But it also includes areas where it says nothing goes there. And it could be that a particular payer is mandating that something goes there. So, yes, different payers have different rules about what goes on to these forms. And if you want to get paid, you got to put in the information that they're looking for. All right. So, Submission of claims according to healthcare setting. I talked about the UB-04 being used for inpatient and outpatient. So you see the different settings in which the form can be generated. And correcting and supplementing the form. Now, let me just say this about supplementing the form attachments. You don't attach unless they tell you you attach something. They don't tell you you attach something, you submit the form, they'll tell you when you need to do something. Okay. So if you have some data entry errors, you can do an adjustment claim. You can also, following that, submit a reopen claim. This is something that occurs after the timely submission deadline. So what that is that payers have we have a certain amount of days to get that claim into the insurance company. If we submit it after that, they don't have to accept it. All right. That's enough about this. We talked about the 1500, the UB-04, very, very high level. But I will tell you, as we get into our last 5 chapters, where, yeah, I think it's 5, 12 through 17, we're going to climb across different payers, very high level. And so this is not the end of you seeing these claim forms. That is all for week number 5. Woohoo!